So I'm Lindsey Manfrin, the Health and Human Services Director for Yamhill County, and I've been in this community, lived in McMinnville since I was 8 years old, and been working with the county for 18 years in lots of different roles. I started out as a nurse home visitor, so I was providing home visits to generally new moms and babies or pregnant women, and we know during that time that can be a really high-risk time for women, and so there were many occasions when I was working with a family, a mom, to try to get them into a place where they'd be safe. And, that has always been Henderson House in McMinnville, right? When we're working with individuals who are in those unsafe situations, that's been the go-to place. After I was a home visiting nurse, I worked in our clinic, and the same thing. People would come in there, and it's often a place where people are very vulnerable and tell you a lot of different things. It's a place where I think there's a lot of disclosures happening when they come there, because it's a place of anonymity. You're coming to the public health clinic, and there's a sort of that guarantee that this is a place where people can share whatever they need to share. And so there was a lot of work, sometimes in the moment, of how do I get you out of this clinic room to somewhere safe, and sometimes more long-term thinking and planning of, what are you thinking in this moment, and how can I support you? And again, in those settings, Henderson House was the place that I would turn to as a nurse to say, this is a resource. And sometimes it was working directly with Henderson House to connect with a family and figure out how we can work together. Now my role is much more on the administrative side, so I'm not providing care or support as a direct nurse anymore, but really it's about, how do I work with other partners? How do we work as agencies to make sure that everyone knows how to access these critical services? And then even broader, how do we work as a community to get ahead of things? How do we work on prevention of domestic violence? How do we work on prevention of, within family systems early on to support healthy relationships? And how do we support making sure that we are doing what we can to protect kids from things like adverse childhood experiences that we know so much about impacts not only the mental health and safety and security, but also the physical health down the road. There's lots of evidence to support how those things are connected. And so with my role within the county, right, it's sort of thinking about whole health of whole people in the entire community. And we can't do that if people aren't safe. If people aren't safe, they can't be healthy. And that's sort of the baseline that everyone needs to have is safety. So I'm excited to be part of this event, just to get the word out of what Henderson House is, how people can get involved. I think this is a topic that people are passionate about. Everyone cares about it. And I don't know that everyone knows exactly what they can do. What's my role in it? And I think events like this help get that message out of, well, this is important. This is important to me. It's important to the community. And this is what I can do. I think certainly it depends on what the situation is. But I think largely I do a couple of things. I try to model it. And I think that can be helpful. I try to step in when appropriate. I think, that looks different in different settings. Sometimes it's not the overt things that people think of when they think about violence, but I think just the language that we use sometimes can be detrimental. And so trying to find professional and polite ways to intercept when something seems like it's going down a path that doesn't need to go down, or that isn't going to create that space of safety for other people, and try to do that in a way that brings people along. So it's not shaming or calling someone out necessarily, but also kind of offering a different path or different words to use that might get the same message across, but in a way that creates that space of safety for everyone involved. And then certainly when there are moments and times where something is a much more overt situation, I think what I try to do is know the resources and offer support, knowing that people are going to be in different places of wanting to take a step or not, but just always making it known that I'm a place that folks can come, and I will do what I can to help them, whatever that looks like for them. And sometimes that's just listening. Sometimes that's taking action. Sometimes that's, calling a phone number together. It really is going to depend on that. But I think just knowing that there's a place that people can go to talk, and to take any next steps if they want to, it can be really helpful. Some of the barriers that exist are, one is just a sheer resources, right? Being able to uproot all of the pieces of your life to maybe make a change is huge. And if you're not able to easily do that through resources that include things like, well, how am I going to keep my kids in maybe the same district so they're less disrupted? How am I going to keep the family pets that we know everyone's attached to? How am I going to make sure that I can stay in a place and not end up in a situation where I'm having to go back because I know that that's risky? So I think that there's just a need for more resources that are available immediately. And I think that's where sometimes things get really challenging with a number of resources in our community is they may exist, but they don't necessarily exist in the moment. And sometimes those wait lists, whether it's for something like this or other things, can be a matter of life and death in some situations. And so having the capacity to have access to resources like sheltering and things like that in the moment are critical, because they really can be life-saving. I think just generalized understanding of where people can access services, I think, is also a barrier. I think that unless someone has walked through it, or they're in a position like I'm in where I have this wonderful ability to connect with so many people, just the general person in the community is not necessarily going to be aware of all of those things. And so the more we can make sure that people know the access points to any of these types of services, I think the better off everyone's going to be.